All right, mandibular forceps. So this is an X-ray. There's a couple more that go to this. But let's understand a little bit about forceps. Okay. When a doctor holds a forceps, if you look at this one, it has that rounded. Most of them have the rounded, obviously, except for this straight one. But if it's straight and it's kind of a universal sort of thing, they're just going to hold it kind of on the roundness of here. Okay. Yeah, like a plier idea. Okay. Otherwise, most of them all have some kind of a bend or a curve. That bend, you want to imagine, is going to go into the palm of your hand. So, okay? So it's going to sit in there just like that. So, you can tell just by the way I'm holding it, this is a mandibular forceps. Okay? So this is the 151. Okay, so this is the 151 prior. Mandibular universal. So this can go anywhere on the mandible. Anywhere. Okay? Your book will specifically say that it's going to be mandibular anteriors and premolars and roots, but this is going to be your universal. Okay? For mandibular teeth. So if we were to compare the two, this still kind of has a bit of that teardrop. It has a little bit of a bend. Okay, so when you're looking at it, if I needed to pick up the 150 and we employ that same rule, that nice bend is going to go into my palm, you're going to see it is pointing right to the arch that it needs to be utilized on. Okay, 150, 151, right, pointing right down, solely just by picking it up. Okay, another thing you can write, the 151 has a bit of a seesaw action. So you can kind of make it, if you were to put it down on its bend, it will seesaw a little bit, whereas you can't get the 150 to do that. If that's something that you like to. So I'm going to pass both of these around so you can kind of see that 150, 151 here. Okay? So 150, maxillary universal, 151, mandibular universal. Always accessing on that buccal and lingual, because you can imagine you can't access on your mesial and distal because there should be opposing teeth. If there's not opposing teeth there, sure, you can adapt anything, and there's instruments that will do that. They're just not going to be as readily used because most of the time something is opposing it, okay? Or adjacent to it, I guess I should say. Okay. So, our next two, we're going to kind of do together, so they're on two different pages. The pictures for both are on the second page. So, our next two are considered cow horn forceps. Okay? Both again, facial and lingual root contour, just apical to that cervical line. They're designed basically the same at the tip. We'll learn some tips are different depending on where you're going to be using them. So the ones that are coming around, the tips have a little bit more of that flatter appearance because we want to access that anterior tooth, so we need a little bit more surface. These, so the number 23 and the number 16 cow horns are both for first and second molars. Okay, so the whole idea, if we look, so first they're called cow horns because they kind of look like cow horns, okay, like a bullhorn. They come to a point. You need to imagine that point is still going to be at that apical area, but we're talking first and second molars that have furcations. Okay, so that point is going to sit right in that bifurcation. So if we were to be able to actually see the root, we know we can fall right into that bifurcation. So it needs to kind of be pointed because we need to really get to that point. We wouldn't want to be down here. You're not going to get as much torque even on the tooth. Right up at that bifurcation, you want those points to drop right into there. Okay? So that's why they are pointed. These are in essence the same exact instrument, so the same exact forceps. The difference is the 23 is straight, so you can make a note straight. picture or somewhere on there. And the 16 is hooked. Okay, so the handle is hooked. That is the only difference between the two of these. Okay, 23 is straight, 16 is hooked. Pointed cow horns. Okay. Everybody good? Okay. So, next two are known as mead ashes. Okay? So we're going to have a number 3 and a number 4. There's a typo on your sheet that we'll get to. Is it on this one? It's on this one. I think that's it. Oh no, it's on the PDF. Never mind. Okay, so mead ash, number 3 and number 4. So let's talk about the mead ashes. They are both parrot-like. So their beaks are parrot-looking. Okay, so I would underline parrot on both of them. Okay. Here's our differences. So the number 3, mead ash, is a small, rounded beak. So I would underline rounded beak. And it is just about closed. When we hold it, it's just about closed. Okay? So 3 mead ash, rounded beak, bless you, parrot looking, almost closed. As compared to the number 4 mead ash, it actually has a pointed beak, which when it comes around you'll see it pretty clearly. It looks like a bird beak that has just little points at the end. Okay? So it's a pointed beak. You want to think that that beak is meant to go right into bifurcations, because the other differences are number 3 is going to be anteriors, cuspids, premolars. The number 4 is molars. Okay, so it has that point, just like the cow horn we talked about as having a point, so that that point can go right into the bifurcation. So 4 mead ash, pointed, parrot, it is open. So see there, when it's closed, it's open. So if we were to hold them both together, we can see the 3 is closed and the 4 is open. Okay. The 4 is pointed, the 3 is more flat.
You said 3 is more open?
Nope, the 3C, it says almost closed. So you just want to underline that. And the 4 is more wide open or open. Okay. When we open them, you can see it will open wider. You can kind of see it almost goes right in. So the 4 will open, 3 is closed. Pointed, but both kind of parrot-like. Okay? So 3 are more anterior, 4 is your molars. Good?